Welcome to the Nursing Mindset series. Remember, in these short videos, we'll focus on how nurses think, not just what nurses do. Developing a nursing mindset is one of the most important skills you'll learn because every safe nursing decision begins with our topic of today, which is clinical judgment. What defines nursing is how we think. Every patient, every shift, and every clinical decision begins with asking the right questions. As we worked through this graphic together, notice that every step begins with a question. Experienced nurses don't memorize answers, they ask better questions. The first question is, what do I notice? This is the recognize cue step. Before you can solve a problem, you have to recognize that one exists. Nurses gather information by listening to the patient, performing assessments, reviewing vital signs, and recognizing changes in the patient's condition. These clues become the foundation for every decision that follows. Once we've gathered information, we can ask our second question. What does it mean? This is where we begin to analyze the cues. Are the assessment findings connected? Is there a pattern? Do I have enough information, or do I need to assess further before making a decision? Good nurses don't jump to conclusions, they pause, think critically, and make sense of the information they've collected. The third question is, what is my priority? Remember, not every problem can be addressed at once. Nurses must determine what requires immediate attention by considering airway, breathing, circulation, so your ABCs. But also, we need to think about Maslow's. So we need to think about patient safety and other priority setting frameworks. Clinical judgment is often about deciding what needs to happen first. Once the priority is identified, we can ask, what should I do? This is where we generate solutions. Nurses establish patient-centered goals, select evidence-based interventions, and collaborate with other members of the healthcare team to develop the safest plan of care. Next comes action. A plan only improves patient outcomes if it is carried out safely. Nurses implement interventions, provide education, delegate appropriate tasks when necessary, and document the care they provide. Every action should support the patient's goals while promoting safe, compassionate care. Finally, we ask, did it work? Evaluation is one of the most important and often overlooked parts of clinical judgment. After every intervention, nurses reassess the patient to determine whether the desired outcome was achieved. If the patient's condition has improved, we continue the plan. If not, we reassess, adjust our approach, and begin the process again. Notice that this isn't a straight line with a beginning and an end. It's a continuous cycle. Every time your patient's condition changes, you start asking these same questions again. Now, these 6 questions form the foundation of the National Council of State Boards of Nursing Clinical Judgment Model, the framework used to teach clinical judgment and prepare future nurses for safe practice and the next generation NCLEX. So as you move through this course, I encourage you to return to these questions often and ask, what do I notice? What does it mean? What is the priority? What should I do? Did I do it safely? Did it work? The more you practice asking these questions, the more natural they become. Eventually, you won't have to consciously think through each step. You'll simply approach every patient with a strong nursing mindset. Remember, every safe nursing decision begins with the right mindset. Keep developing your nursing mindset, and we'll talk next video.